Sangat, iHEAR newsletter reflecting on our 2025. Take a look back on 2025 with us. How our projects were shaped by and co created with our communities. How we have been making a difference in disability and LGBTQIA mental health advocacy and research, and the people leading the work at iHEAR. Page 2. Dear friends of iHEAR, 2025 has come to an end and 2026 begins, bringing a new year of hope for iHEAR. 2025 was not an easy year for iHEAR. After 4 years of growth in people and projects, last year our team shrank to its lowest numbers in both. Behind these numbers, we faced a larger setback, a pullback in global health funding, especially related to health equity, with cascading impacts. It was also difficult as another much more personal and individual tragedy struck iHEAR. A beloved colleague and friend, Bhakti, passed away after a prolonged struggle with cancer. Some of us were able to see her before she left us, some of us saw her family after, and a lot of us came together in her memory. Finally, there was a wave of burnout across iHEAR, linked to relentless work over the last 4 years, combined with personal loss, mental health crisis, relationship struggles, funding uncertainties, loss of opportunities, disability, and health issues. What has kept us going has been some rays of hope. Thanks to a kind feminist donor, we have received core funding under the Anchoring iHEAR project to reflect, rest, and plan what iHEAR can look like in the coming future. In partnership with colleagues from Sangat Delhi, we embarked on a new project, Youth Learn, taking us in a new direction. Youth Learn looks at participation and lived experience leadership in the context of youth with mental health problems. Our work with the Gates Foundation has been extended for another year. And thanks to these projects, what was even better were the new colleagues who have now joined us. They have added new flavor, renewed enthusiasm, and energy into the team, much needed for many of us. Along with them, in a new composition, iHEAR looks at 2026 as its 5th year of existence with hope, as a year that would help us consolidate our learnings and gains so far, reconcile our losses, and strategize for the near future. If you have been part of our work or have been following our work enough to read this newsletter, we would love to hear your ideas on how we have been doing and what we could do differently. We have always benefited from the insights shared by all of you. You can write to us at iHear@sangat.in. Wish you a wonderful 2026. Hari on behalf of the iHear team. Page 3. Projects concluded in 2025. Transnet logo. The Transnet project explored how intersectional identities shaped experiences of transgender, non-binary, and gender-diverse individuals, in brackets TNBGD, in India facing technology-facilitated gender-based violence, in brackets TFGBV, and how we respond to the violence. This project was funded by the Feminist Internet Research Network, part of the Association for Progressive Communications. On the right side, we have images and descriptions of events that occurred under the Transnet project. We presented the preliminary findings from the Transnet project at a symposium on queer trans mental health. This was co-organized by TIS Mumbai, Nimhans Bengaluru, Sathi, IIT Palakkad, and iHEAR Sangat Bhopal. Image next to this text, alt text. From the symposium, a group of people all looking at and discussing around a notice board with sticky notes. Caption for the image, in quotes, care in practice and policy, dialogues in queer trans mental health, end quote, at Bangalore. End of image caption. Next event. 26 TNBGD people joined us at a co-design workshop and community consultation to reflect on the findings of the project and share their inputs to co-design a toolkit to navigate online violence. Photo from the workshop and consultation, alt text. 4 people from the iHEAR Transnet team, Isha, Sharon, Hari, and Joshua, are gathered around the iHEAR posters at the event and are smiling to the camera. Caption for the image, in quotes, transforming the tech, end quote, at Bangalore. Next image, alt text, a very long red cloth pinned on a concrete wall. On the wall are embroidered various scenes that are hard to make out. Caption for the image, Priya workshop at Delhi. Next image, Isha from iHEAR with 4 other people from diverse ethnic backgrounds. All are looking and smiling at the camera. Caption for the image, Commission on the Status of Women 69 at United Nations, New York. Next image, Hari Sharon from iHEAR and Napat from MORU, the facilitators of the workshop, are standing around a bright blue notice board with sticky notes all over it. They are smiling at the camera. Caption for the image, Connectors Workshop at Bangalore. Next image description, Sharon from iHEAR in a boardroom at T Hub, Hyderabad. They are with 5 other people seated around a U-shaped table. Caption for the image, in quotes, whose bodies, whose data. Accountability in the politics of gendered and queer data, end quote. Digital Citizen Summit at Hyderabad. On the left side of the page, there is additional text as follows. We published the summary of our findings on genderit.org titled, open quote, iHEAR Transnet Intersectional Experiences of TFGBV among the trans, non-binary and gender diverse communities in India, end quote. Our researchers also wrote about the complexities in navigating their roles as researchers while also being counselors and peers in their community. Open quote, liminalities of researcher positionality, blurring roles as researchers, counselors and peers, end quote. The full research paper and toolkit will be published in early 2026. Page 4. Projects concluded in 2025. The Mahe x iHEAR project. The Mahe x iHEAR project centered around mental health support, craft preservation and income generation through workshops. The workshops were held in collaboration with Mahe Center, a women, queer and trans-led free skill building collective based in Moirang, Manipur, funded by the Direct Aid program in Kolkata. On the right side, we have images from the workshops held under this project. Image 1, alt text, 2 women during the workshop weaving on a handloom. Caption for the image, handloom weaving workshop at Moirang. Image 2, alt text, 9 people from the queer community sitting on a carpet on the floor and trying out makeup on themselves. There's a lot of makeup spread out on the floor. A large rainbow flag is on the wall in the background. Caption for the image, makeup workshop at Moirang. Image 3, alt text, 2 people at a sewing machine table. One of them is teaching the other. Caption for the image, advanced tailoring workshop at Moirang. Image 4, alt text, 6 people surrounding a large red cloth for a potloy. A few are working on the embroidery. Caption for the image, potloy workshop at Moirang. Image 5, alt text, the iHEAR and Mahe team in a group photo smiling at the camera. The background is a large rainbow flag. Caption for the image, mental health workshop, Moirang. Image 6, alt text, the iHEAR and Mahe team in a group photo smiling at the camera. The background is a large rainbow flag. Caption for the image, mental health workshop, Moirang. The left side of this page has a quote by a participant. Open quote, joining this training has been not just a learning journey but also mentally beneficial through the gatherings and collective sharings. This space has been a resting place for trans women like me. I hope bigger opportunities come in the future. End quote. KH Machathon, trainee. The next section has images from the Mahe team's exposure visits. Image 1, alt text, the Mahe and Solidarity Foundation team in a group photo smiling at the camera. There are 14 people in total. Caption for the image, the Mahe team's exposure visit to Solidarity Foundation at Bangalore, Karnataka. Image 2, the Mahe and Ekam Foundation team in a group photo smiling at the camera. There are 10 people in total. Caption for the image, the Mahe team's exposure visit to Ekam Foundation at Dibrugarh, Assam. Page 5. Projects concluded in 2025. Access Matters. Access Matters is an action research project that trained people with disabilities to become field investigators in brackets FIs to conduct accessibility audits of public hospitals in Goa and Madhya Pradesh, funded by the Azim Premji University. On the right side, we have images of trainings and dissemination events that were conducted after the findings of the audit reports. Image 1, alt text. A group of people sitting around a table and talking and showing each other what they have written. Caption for the image, dissemination training at Bhopal. Text next to the image says, the Bhopal training was held in collaboration with the National Health Mission in Bhopal, where the iHEAR team held a half-day training for 130 plus civil engineers. Image 2, alt text. Group photo of all participants, facilitators and the entire team. Some are sitting on chairs, some are sitting on the floor, some are standing, and there are some wheelchair users that are visible. Caption for the image, Disability Conclave at Bhopal. Next to the image, we have text that says, at the conclave, we shared our findings and challenges with 50 plus participants from disability rights organizations and created plans for advocacy at state and local levels. Image 3, alt text. A scene from a training. A person is pointing to a poster with images from the audit report and others are watching the poster. Caption for the image, dissemination training at Goa. Image 4, alt text. Participants sitting around many tables discussing and writing. There are also persons with disabilities such as wheelchair users that can be seen participating. Caption for the image, dissemination training at Goa. There is text following both these images to give additional context. We collaborated with the Disability Commissioner's Office for our Goa training. The event included a sensitization session from people with disabilities, research findings, a gallery view of site photos, and co-creating action plans with disability community members. Image 5, alt text. Field investigators who are persons with disabilities meeting district level government health officials at a government office. Caption for the image, district level dissemination at Madhya Pradesh. Image 6, alt text. Field investigators who are persons with disabilities meeting another district level government health officials at a government office. Caption for the image, district level dissemination at Madhya Pradesh. Text that gives additional context for image 5 and 6. Led by our field investigators, the district level meetings typically brought together key government stakeholders including the Chief Medical and Health Officer in brackets CMHO and brackets, civil surgeon and NHM engineers. Discussions focused on future actionable steps based on the audit reports from the project. On the left side, we have text and images as follows. Text, our work was extensively highlighted across local newspapers. Here are a few features. Image 1, alt text, a clipping from a Bhopal newspaper with the title, open quote, persons with disabilities underline systemic shortcomings in hospitals, and subtitle, need for changing lens for actual change, audit conducted with NHM, end quote. Image 2, alt text, clipping from Goan newspaper with title and subtitle, open quote, audit finds gaps in accessibility at 11 government hospitals in Goa. iHEAR initiative highlights urgent need for inclusive healthcare design, end quote. Images 3 and 4 are newspaper clippings from a Bhopal newspaper about the district level meetings. The text in the newspapers are both in Hindi. Page 6. Projects concluded in 2025. Affirm Care. Affirm Care worked towards promoting LGBTQIA+ inclusivity in medical education in Kerala. We conducted 8 workshops from 2024 to 2025 for medical educators and students, along with a community consultation, supported by the Australian Consulate General, Chennai. On the left side of the page, there is text and images as follows. We published a guide for medical educators in Kerala on LGBTQIA+ affirmative care. Image alt text. Cover of the booklet, there is an illustrated image of 3 queer Indian people hugging each other. Caption for the image has the name of the booklet in Malayalam, which translates to Colors in Your Care, published in June 2025. We also held a virtual dissemination webinar in June 2025 to share our experiences from the Affirm Care project. Image alt text, poster of the dissemination webinar with pictures of the speakers. On the right side of the page are images from events held under this project. Image 1 alt text, a man holding the Colors in Your Care booklet and 2 other men looking on from behind. Caption for the image, faculty workshop at Malabar Medical College, Ulieri. Image 2 alt text, screenshot from Zoom with people who are part of the consultation. Caption for the image, consultation on LGBTQIA+ healthcare access in Kerala, held virtually. Image 3 alt text, a snapshot of part of the faculty at the workshop. They are sitting in a room talking with notepads and pens in their hands. Caption for the image, faculty workshop at AMCHSS Trivandrum. From the same faculty workshop as image 3, alt text for image 4, another image of a man standing who is holding the booklet in his hand and speaking while others behind look on. Caption for the image, session on learning methods by Dr. Khan Amir Maroof at AMCHSS Trivandrum. Image 5 alt text, Dr. Sitendra Singh speaking on a mic and pointing to a screen as he presents during the workshop. Caption for the image, faculty workshop at Government Medical College at Calicut. Image 6 alt text, group photo of the participants and the team. There are numerous people. Caption for the image, faculty workshop at Dr. Mupen's Medical College, Wayanad. Image 7 alt text, group photo of the participants and the team. There are numerous people. Caption for the image, student workshop at Government Medical College, Trivandrum. Image 8 alt text, group photo of the participants and the team. There are numerous people. Caption for the image, student workshop at Dr. Mupen's Medical College, Wayanad. Page 7. Projects concluded in 2025. Queer Chronicles, Queer Health Narratives. The Queer Chronicles project looked at collecting first-hand experiences of LGBTQIA+ persons across India within health and healthcare settings. Participants were mentored to develop their experiences into compelling narratives to be used by health professional educators to teach queer affirmative competencies. Carried out in collaboration with KMC Manipal, U Chicago and UCMS Delhi. Funded by the Susan and Richard Kiphart Center for Global Health and Social Development. On the right side, we have various images. Image 1 alt text, a group of participants and people from iHEAR sitting around a table and using sketch pens and other art supplies to draw and write. Caption for the image, Introductory Workshop, University College of Medical Sciences, UCMS, Delhi. Image 2 alt text, group photo of participants and people from iHEAR standing and sitting around stairs. Most of them are holding up their zines. Caption for the image, Zine Making Workshop, Bhopal. Image 3 alt text, a poster announcing a workshop. Caption for the image, Reflective Writing Workshop, held virtually. Text following these images. Participants who are interested in sharing their experiences were then mentored to develop narratives over the course of several months to create a pool of 18 first-person narratives. Participants then exhibited their narratives and shared their experiences with medical educators and health professionals at U Chicago, Delhi during the symposium. Image 4 alt text, a behind the scenes picture. A person is drinking through a cup and a cameraman is recording through his camera. Caption for the image: behind the scenes of an audio-visual shoot. Image 5 alt text: a snapshot from the symposium. There are many people sitting in the hall around the tables. Caption for the image, in quotes: advancing queer and disability inclusion, iHEAR National Symposium on Health Humanities, end quote, at UChicago, Delhi. On the left side, there is text as follows: Behen Box wrote an article highlighting the project and our efforts to make healthcare more inclusive. Image alt text: screenshot of the media article with the title, open quote, How an Arts Campaign Seeks to Bring Gender Sensitivity to Healthcare, end quote, by Priya M. Menon. After the symposium, the narratives were uploaded to iHEAR's social media accounts. The narratives are currently being converted into a teaching guide as well as an online repository that can be readily accessed by educators and trainers looking to incorporate them into their workshops and curricula. Page 8, Section 1. Heading: New Projects. Anchoring iHEAR. iHEAR has received one-year funding to reflect on our body of work and move towards a sustainable future. We will be focusing on creating and sharing accessible resources and research from all our projects. Our team will also get some much-needed support to rest, connect with each other, learn from other organizations, and chart our long-term plans. Youth Learn, Lived Experience and Research Network. Youth Learn is an initiative by Sangat that brings together young people with lived experience of mental health issues and neurodivergence, along with mental health researchers across India. The project focuses on building meaningful, ethical, and inclusive ways for youth with lived experiences to engage with and shape mental health research in India. Commissioned by the Wellcome Trust, UK. iHEAR Equip. The Equip project has been extended. This is a Sangat BMGF initiative that looks at integrating considerations of ethics, equity, and community engagement in health research and programs via workshops, consultations, and other resources. Section 2. Heading: From Our Team. What's one word for your 2025 at iHEAR? Responses: adolescence, attrition, exhaustion, reflectful, community, inclusive, near death and recovery. Finally, in brackets, getting some funding for core activities. Burnout, grief, collaborative leadership, perseverance, and exciting. What's something that supported you and something that made it harder in 2025? Here are responses that have been collated from all our team members. 1. People. 2. People. Sangat's world-class financial standards. Support: team, friends, movies, music, coffee. Harder: grief, ADHD, fear. Not being able to see people in person made it hard, but in-person meetings that happened gave meaning. People filling in payee registration and sending all their details on time somehow. Starting therapy, working from home, being medicated, having weekly check-ins. Team members stepping in for so many things. Supported: team really appreciate, can't be more grateful for a good team. Harder: systemic challenges. Judiciary in brackets supported. Bureaucracy in action in brackets made it harder. I started liking huddles from this year. What supported me was having a team of passionate team players. What made things harder was taking up more work than I could imagine. Interpersonal conflicts was hard, but steps towards resolution helped. Task lists, finance work. Page 9, Heading 1, Publications from iHEAR Projects. April, Gender IT. Liminalities of Researcher Positionality, Blurring Roles as Researchers, Counselors, and Peers. June, Human Vaccines and Immunotherapeutics. Building Trust and Equity in Vaccine Communication through Community Engagement. July, Indian Journal of Medical Ethics, Ethics in processing research participants' payments, navigating institutes' finance and administrative mandate. July, medical education, unmasking the professional doctor archetype. October, vaccines, adapting the WHO BEST COVID-19 survey to examine behavioral and social drivers of vaccine uptake among transgender, intersex, and disability communities in India. November, gender IT, iHEAR Transnet, intersectional experiences of TFGBV among the trans, non-binary, and gender diverse communities in India. Heading 2, other publications from our team. February, Indian Express, how India can become the Vishwa Guru for transgender healthcare. April, Indian Journal of Medical Ethics, assessment for inclusion, promoting equity and justice in disability assessment boards in India. June, Indian Express, blanket ban on blood donation by trans people, sex workers. Ensuring blood safety is non-negotiable, but stigmatizing policies is the wrong way to ensure it. Page 10, continuation of other publications from our team from the previous page. July, International Journal of Mental Health Systems, characterizing modifications to the MH-GAP intervention guide during implementation in low and middle income countries using the FRAME. August, the print, MBBS guidelines for students with disabilities reduce a life to a limb. October, Hindustan Times, saving student lives with institutional interventions. October, PLOS Mental Health, lived experience response to disinformation campaigns. November, PLOS Mental Health, reparations not remuneration, redefining the future of lived experience. December, the Journal of Inclusion and Disability, beyond the numbers, reimagining health through the lens of disability. December, advances in physiology education. Bias in the basics, a multi-loop framework for auditing foundational medical texts through an equity lens. December, the print, making doctors prove their disability all over again isn't how you curb fake certificates. December, the wire, re-examined, re-verified, Maharashtra's humiliation of disabled workers. Dr. Aksa Sheikh and Dr. Satendra Singh also appeared in podcasts. Dr. Aksa also gave a speech at a TEDx event. Image 1, alt text, thumbnail of the podcast with the text on top, the unheard story of a transgender doctor. The interviewers and Dr. Aksa's picture are also there in the thumbnail. Image 2, alt text, thumbnail of the podcast with the text on top, Unbreakable Survivor, how a polio survivor lifted others. The interviewers and Dr. Satendra's pictures are also present in the thumbnail. Image 3, alt text, thumbnail of the podcast with the text, the episode India isn't ready for, the truth about being trans in India. The interviewers and Dr. Aksa's pictures are also present in the thumbnail. Image 4, alt text, thumbnail of the TEDx video which has Dr. Aksa standing on a stage with a screen behind her. There is also a QR code present on the page to scan to view all publications and videos listed throughout the newsletter. Page 11, title, Our Achievements and Recognitions. Image 1, alt text, screenshot from Zoom with the presenter from WHO Geneva Sal. The presenter is reading out the network members and there is a sign language interpreter. The text on the image says Sangat India. Caption for the image. Sangat was accepted into the WHO Disability Health Equity Network as a result of Sangat's long-standing work with persons with disabilities. The iHEAR team applied on behalf of Sangat. Image 2. Alt text. Dr. Satendra Singh accepting the WHO Sero Public Health Champion Award from a white woman. There is a presentation behind them with information about Dr. Satendra. Caption for the image. Dr. Satendra Singh received the WHO Sero Public Health Champion 2025 award in the individual category for championing disability inclusion in health systems and medical education. Image 3 alt text. Anand, Hari, and another person from London School of Economics standing in front of a presentation which has the title slide displayed. Caption for the image. Dr. Anand Ban and Dr. Harikirtan Raghuram were invited to London School of Economics, LSE, UK to speak about, in quotes, co-designing inclusive healthcare for LGBTQIA+ and disability communities in India, the iHEAR initiative, end quote. Image 4 alt text. Dr. Aksa in conversation with 4 other panel members and a moderator. There is a projection of their images in the background. Caption for the image. Dr. Aksa Sheikh was appointed to the jury for the Pride Fund India. The Pride Fund India looks at providing consistent funding for grassroots level LGBTQIA+ organizations to create lasting impact. Page 12. Continuation of our achievements and recognitions. Image 1 alt text. A group photo of the awarded fellows. Hari is sitting on the bottom left side and smiling. The background has green hedges everywhere and a lawn on the floor. Caption for the image. Dr. Harikirtan Raghuram was awarded the India Health Policy and Systems Research Fellowship. Their proposed research under this fellowship is on, quote, participatory action research to develop principles for trans and gender diverse inclusive physical infrastructure in hospitals, end quote. Image 2 alt text. A group photo of the task force members sitting and standing outside a red brick building. Dr. Aksa is sitting on the lower right corner and smiling. Caption for the image. Dr. Aksa Sheikh was appointed by the Supreme Court to the National Task Force on Mental Health of Students and Prevention of Suicides in Higher Education Institutions. Image 3 alt text. Parth is on a podium and speaking into a microphone. They are wearing a black suit. Caption for the image. At the 7th Global Mental Health Summit, Parth Sharma co-presented their paper on, quote, From Policy to Practice, Lived Experience Researchers Assess WHO's Mental Health, Human Rights and Legislation, Guidance and Practice, end quote. They were appointed the first Deputy Principal Coordinator for Movement for Global Mental Health and moderated 2 research presentations. Image 4 alt text. Sharon and Joshua are standing in front of a non-binary flag and smiling. Joshua is looking at the camera with one of their hands making the peace sign. Sharon is looking away from the camera. Caption for the image. In September 2025, iHEAR was among 30 non-binary and gender non-conforming activists from South and Southeast Asia who convened as the first cohort of a regional alliance to guide inclusive advocacy and gender-expansive practices. From iHEAR, Joshua Mark George was on the organizing committee and Sharon D'Souza attended the convening. Page 13. This page has 2 sections. Section 1 heading. Welcoming our new joinees. Images of 2 women who have joined the iHEAR team in 2025. They are smiling at the camera. The caption for the first image says, Munira Electricwala, MSc Clinical Psychology. The caption for the second image says, Angela Melanie Rego, PGDP Dance Movement Therapy. Section 2 heading. Saying Goodbye to. This section has images of 5 people who left iHEAR in 2025. Each person's image has a caption of their names and they are 1. Fateh/Anushka Work, 2. Ghazala Parveen, 3. Moon/Muskan, 4. Rajan Negi, 5. Shilpi Verma. Page 14. Heading Remembering Bhakti Ghatole. Bhakti joined iHEAR in 2021 as a research assistant and worked across multiple projects such as Vaccine Equity 1 and 2 and Access Matters. In 2025, Bhakti passed away after a prolonged struggle with cancer. Bhakti, We love, miss, and hold on to your wit, conviction, wisdom, and your incredible capacity for love. And what is grief, if not love persevering? There is a collage of 6 pictures. The collage consists of images of Bhakti by herself and with her colleagues and friends at iHEAR. Some are outdoors, like in a boat or on a field, while others are at work events in a conference hall. Page 15. Heading: Snapshots from our year. This page features a collage of 21 images of our team from all through the year. A large number of them are group photos. There are informal group photos of people making funny faces at the camera, and there are also more formal group photos. There are also individual pictures like Parth posing with a lampshade above their head, Sharon and Hari's photo booth picture strip, Shilpi feeding cake to Fateh, Anand and Hari in front of the London School of Economics building, and many more such images. Page 16. Heading: The people who made iHEAR in 2025. This page has an exhaustive list of all the people who have been involved in any capacity with iHEAR in 2025. After the list, there is text at the bottom that reads, "We're sorry if we missed names of any of our friends, colleagues, or collaborators. Our thanks extends beyond this list and to all who have been part of our journey." Page 17. Heading: Reach out to us. There is a list of iHEAR's contact information. Email: ihear@sangat.in. Website: www.sangathequity, which reads as www.sangat.in/health-equity. Instagram handle: instagram.com/ihear_sangat. Twitter or X handle: x.com/I capital H capital E capital A capital R underscore capital S ANGATH. Address: Sangat, Bhopal Hub, plot number 106, Good Shepherd Colony, Kolar Road, Bhopal, Madhya Pradesh, pin code 462042. Page 18. Sangat and iHEAR logo followed by